Hello, I'm Dr. Tom Schwieterman. Welcome to Thoughts with Leaders. I have two main functions in Midmark. The one side is the quality and regulatory, and it's more the clinical affairs side, which is around making sure products are safe, effective, all the risks are managed, and that we know when a product goes into the field of medicine that it's going to do what it's designed to do and do it effectively. That's the more deliberate sort of rules-based side. The other thing I do is around strategy. I'm heading the strategy council, which is around where we're going and why we're going there. What are the trends in the industry? What can we do differently to make the lives of our customers better? And they're really yin and yang. The one is more rules-based and one's more creative. So I have a very big gift here in my job that I can play both hands. I can play the more rules-based guy and the more dynamic strategy guy. It's fun. That's actually the hardest thing I ever done in my professional career. As you know, training to be a physician is a long and arduous path. In fact, it was 11 or 12 years since high school that I was in either training or I was doing some sort of preparatory work for clinical medicine. And then after 10 years of practice, to kind of give that up and go to a corporate side was really a tough decision. I'll never forget the conversation with my dad. But the reasons are really quite simple. I practiced as a small town doc in a nearby town here, and I knew it could make an impact on those patients, and I missed that dearly. But when you work for a company like Midmark, you have hundreds of thousands of points of care that you can mitigate issues around. You can make those lives better for those doctors and patients. And I also have this background in software engineering, and I knew medicine was going more digital. And so I could bring not only the clinical skills, I could bring the software engineering skills and help design solutions that make lives better. It's been exceptionally rewarding to be in the corporate side of the fence here. I do consider myself an ambassador to my customers, though. I am a clinician first, and I am a corporate businessman second. The COVID pandemic was an amazingly interesting time for me as a chief medical officer because it was really for the first time that I really had to use my clinical skills, not for the customers we take care of or design products for, but for actually our own teammates. What I learned real quickly was that there was so many unknowns in the COVID pandemic. We had a brand new pathogen, we had a brand new dynamic of contagiousness. And what I quickly realized is that there's a whole lot of people in the organization that knew very little about all of that. And as a physician, I knew how that whole process worked. I knew how viruses attack the body. I knew how the transmissions would occur. And it became very apparent to me that everybody was looking at me with, what are we going to do? How are we going to manage this? And it reminded me of the times that I delivered babies, when you were in the delivery room and you could just sense all the eyes were upon you because you were managing this fairly complex situation, and how I carried myself, how I presented the information. And they needed a trusted resource to look to say, hey, this is going to be all right, we're going to get through this. And so it was very rewarding for me to take this clinical knowledge I have around really just a traditional disease management model and help my fellow teammates through it. It was very rewarding, and for me to be able to leverage my skills was just probably one of the most rewarding things I did in my career. Thanks for following me around today with Thoughts with Leaders. I enjoyed it very much. Until next time.